website. G.T. Thompson from Pennsylvania, thank you for being with us this afternoon. Let me yield to you such time as you may consume.
Well, I thank my good friend Dr. Burgess from Texas for yielding, and also for being able to work with him in terms of our Congressional Healthcare Caucus. We cover the healthcare industry from both important aspects. You as a physician and all of your experience in the medical, specifically the medical field. My background came up through therapy, and most of my almost 30 years of working in nonprofit community healthcare was really on the administration side. Some as a therapist, but largely in administering programs in hospitals, in comprehensive rehab centers, nursing homes, as licensed as a nursing home administrator towards the end of my career there, and frankly dealt very, very closely with Medicare, out of necessity, because Medicare is, on the inpatient side, is at least 60%. In terms of market share, in terms of payment. And so Medicare is very important. I have to say to my good friend, I was pretty naive when I came to Washington in January 2009. That's when I was sworn in. I won the election in 2008. I thought everybody knew that the impending crisis one of those had to do with the insolvency, the eventual bankruptcy of the Medicare program, only to get here and find out that that was not on the agenda under the previous leadership, and frankly it has emerged because it is a truth. When you look at the situation today with the Medicare system, Medicare is in jeopardy. And what we're trying to do, what the Republicans are trying to do, is to save Medicare. The thing that would hurt Medicare the most is to do nothing, to further kick that can down the road. Just by coincidence, I stopped by earlier, I was off the hill, stopped by, and I picked up a prescription earlier today. You know, the only prescription to save Medicare is a Republican prescription. I have to tell you, on the Democratic side, they're just willing to pull the plug and let it die. Because if you don't make changes to the Medicare program, that's exactly what happens. And that's not political rhetoric. That's coming from some pretty credible sources that you talked about. Last Friday, the Medicare confirms that the Medicare program is already contributing to the federal deficit and will continue to do so for the next decade. That since 2008, the program has run a cash flow deficit, a fact that's been largely ignored in Washington, and still there are those of our colleagues who choose to pretend it's not true, but it is the truth. And in fact, 2011, that exceeds $32 billion. That's a program that is, if we don't make necessary reforms to save it, it will go bankrupt. And what an injustice that will be for all of us, all the people across this nation who have paid into that program, who are looking forward to hitting those retirement years to be able to access and utilize that benefit. If we allow it to go insolvent, if we don't reform it, we don't save it, it goes bankrupt. The only thing keeping the program afloat financially really is the sale of Treasury bonds in the Medicare Trust Fund. And when those bonds are cashed, that increases the deficit. So what we're seeing, the president, I don't know if his plan, I guess, is to let it to go insolvent, because I read today he's restated he doesn't want to do anything about Medicare, leave Medicare alone, which essentially says let's leave it go bankrupt, let's let it go away. And in fact, the measures, and you did a great job of, I think, talking about one in particular, the Independent Advisory Board, which essentially takes the decision-making out of the hands of those of us who are accountable, those of us who are elected every 2 years to make decisions about Medicare. And those decisions will not be about what benefits to expand in this financial situation. This will be about where to make cuts, where to ration care. And, the federal government already does that. Under Part B, if you are in a nursing home and you need to receive rehabilitation therapy, the federal government has already put a cap on how much therapy that you're able to receive. And it has nothing to do with what your need is. It has to do with how much dollars have been spent. So if Americans think that the federal government would not do rationing, it already happens. It already happens. You talk about the board. We've got what the president has done. I think his plan, which really I think is going to pull pull the plug on Medicare, a program that's already financially insolvent and challenged. He cut $575 billion from the Medicare program to fund his health care initiative. He cuts over $200 billion from Medicare Advantage and forces over 7 million seniors out of their current Medicare plan. The projection from the CMS actuary, this is the person who is responsible for really crunching the numbers for the Medicare agency, Richard Foster, in April 22nd, 2010, he said 15% of hospitals, nursing homes, and home health will close because Medicare pays less under Obamacare. We have an opportunity here to do the right things and to reform Medicare and to save Medicare. You know, the president has an obligation to do that. Under the Medicare Trust Fund, there actually is what a lot of folks don't know. There is a requirement, a statutory requirement, that at whatever point the Medicare Trust Fund is using more than, reaches a 45% level for more than 2 years, the president is required to put forth a plan essentially to save Medicare, to be able to address Medicare. We are way past that trigger. And President Obama knows that. I assume he knows that. It's a part of his job. And he has, so he has chosen to ignore his responsibilities to really put a plan forward. And in fact, when we were at the White House just earlier this week, the president said that he was not going to put a plan forward for dealing with Medicare. He was going to just not take the leadership on that issue. We have, and I'm very pleased with the plan that we have put forward. It has to do with putting premium supports. Our plan would direct Medicare to go out and to bid out for many different vendors, health care plans that seniors could then shop through. Medicare sets the standards. These companies that would put these products forward have to meet Medicare requirements. It's not a new concept. It's what we do under Medicare Part D today. And Medicare Part D is probably one of the few government programs that have actually come in under budget. Most government programs come in way over budget. I think we know that. But Medicare Part D has come in under budget. And it also is going to put, I think, an emphasis on prevention and wellness. And that's the most cost-effective type of health care full well. That's what we need to do, obviously. That's the best thing for the individual, for folks to remain healthy as possible. We're not talking about voucher programs. We're not talking about privatizing Medicare. Those are concepts that that's just not true when people claim that we are. We're talking about providing people choice of quality products that meet a minimum standards that the Medicare agency will assure that's there, because they're the ones that are going to bid this out and manage the process. And then we're going to provide premium supports to allow our seniors, and we're talking about just impacting people that are younger than 55 years of age. If you're 55 years and older, there won't be any change. Although I've bumped into a few that want to know why they can't have this opportunity, because they think it sounds like a really good thing. But the fact is, what we're doing is holding those harmless, age 55 and older. And so I think it's very important that we have this debate, but it's a debate that brings forward all the facts and the realities of what we're talking about. And what we're talking about is doing something that will actually, I think, improve Medicare, just like Medicare Part C, which is Medicare Advantage, has been shown that seniors on that has allowed individuals to be, because of the emphasis on prevention and wellness, they've been hospitalized fewer days and for smaller length of stays, which has saved money in the long run, and it's kept people healthier. So we're talking really a positive investment in the health care of our seniors, to be able and saving the country money, and frankly, saving Medicare. And so I appreciate the opportunity to join my good friend from Texas. And this is a conversation I think that's going to be very important. We continue this conversation all throughout the rest of the spring and well into the summer.
Well said, because that is exactly the point of this exercise this afternoon. These aren't difficult concepts, and they are very